I know we're going to get into the pediatric side.
Right.
You brought your baby. And we're going to get into that, but we're going to go through some general things first, some personal things as well.
Gotcha.
Some technical things.
Gotcha.
General things, have you, just so I know, have you had direct contact with Dr. G?
I got to sit in his lap as a kid, and I attended seminars when we were children. Dad was taking the seminars, about 20 live ones, and so as children, we were there. But I started chiropractic college the year he passed away, but I was in his presence about 20 times. Yeah.
Okay.
So it's a little bit different history. Yeah, it's a little. It's
okay.
it's almost generational. And I would use generational. That in some ways in Gonstead, it's passed on to 2 to 3 generations, and so.
Okay. I'll ask your dad
Yeah,
a little bit more about the direct contact.
You're right.
Okay, so let's just get started. We are meeting for the first time.
Yes.
So go ahead, give me your self-introduction.
Hi, everybody. I'm Dr. Claudia Anrig, and I'm a family wellness chiropractor, but I'm second generation. So my upbringing was when I was a kid growing up, was when our body wasn't functioning well. We never thought about using drugs or chemicals or anything like that. It was just getting up and basically getting an adjustment. And so all I've ever been around is chiropractic. And so it's not unusual for me to have gone to chiropractic college, but I live in Fresno, California. I've been practicing for 40 years now, and the babies in my practice are all growing up and now having their babies, and so I get to see a second generation of people growing up.
And since we're already there, that kind of go into, as someone who sees kids, toddlers, infants, all the way, give me a little bit more background into the, as you say, multi-generational aspect of Gonstead.
Right. Yeah, what's amazing about Gonstead work is that it really attracts often many generations of chiropractors having their kids becoming chiropractors often, and even fulfilling in their practices or going out on their own practice. So it's been a great career. Dr. Gonstead was so influential with the technique of how to find subluxation, the correction. It really looked easy when people were watching their moms and dads adjusting and just seeing all these great outcomes. But generational can also be in our practices when we are taking care of pregnant women to newborns. Eventually they all grow up, and someday hopefully they're going to become chiropractors themselves. But in chiropractic, and particularly family wellness, Gonstead chiropractic, we see everybody, we come in the world with diapers and we leave with diapers, and we can see many generations because in that technique we can adapt it to the needs of the individual.
And so what I was asking Dr. Jeannie yesterday a little bit about working on young people, right? I have a 2-year-old, or she just turned 3 2 weeks ago. And I'm thinking about what kind of sports, what kind of activities to get her involved in, and just get her body moving and growing and do everything I can as a parent for the best development for my child. So when you're talking to a parent like me who's considering what should I have my kid do, what is your sort of pocket response or elevator pitch?
Right. I think the last thing you want people to do is to get into high competitive sports where you're doing things year round, because the body is really, while it's growing and developing, what you're doing is putting your child's body into an asymmetrical or one-sided movement. So actually in the long term, when they grow up someday and they're 30, 40, or 50, that particular sport is really going to have a damaging effect on them. And it's just not about muscles and joints, but it's also the nervous system. Their physiology can be altered. So anything that could be a sport of balance, like maybe swimming would be a sport of balance. I think the European model is more the model to go to, which is actually more fitness, hiking and bicycling and things that would use both sides of the body. But the model in Europe is more about fitness and lifestyle, not a fanatic approach in sports. And I think this is why we're seeing so many injuries. And so I go with more the European fitness model, that it should be for health and well-being, but not for being acclaimed or applauded at the end of something, because they have another 50, 60 years ahead of them, and they could be damaged goods by the time they get there, living in the moment in their teen years or elementary school years.
Since we're kind of visiting this topic, and I'm an avid sports fan and player, nowadays with advances in technology and analytics in particular, you can really measure an athlete's performance, and it's almost like you can predict the athlete's performance. And injuries is a big thing in the NBA finals. It's a big thing. Talking about like load management is what they call it in a lot of different sports now. And I'm just curious for you, like when you hear about these things, and you said asymptomatic, so I'm thinking like baseball, you're using your right hand a lot versus like, you know, your left hand's doing this, your right hand's doing this. Basketball, same, you shoot with one side versus the other. And so, correct me if I'm wrong, but popular American sports, NBA, NFL, especially NFL, what are you saying that these kinds of asymmetrical sports are in fact more damaging than they are good?
Yes. Yeah. Well, I'm looking for long term for whole wellness and so forth. So it's really hard when you have a competitive nature and let's say you're gifted in a particular sport. So it's hard for that competitive nature, but I'm looking at somebody, what they're going to look like or feel like in 20, 30, or 40 years. And any of my professional athletes that I've taken care of from, from football and from basketball and so forth, and I've taken care of probably close to a dozen in my practice lifetime. Although they love this sport, how they're living with the chronicity of their issue, the aches and the pains and the amount of things they have to manage with drugs, and even though they know it's damaging. So I look for the big picture of quality of life. So it's a different perspective. Maybe that comes from my prenatal and pediatric background, is looking more long term. But certainly I'm not against sports. It's just, I think if, not everybody's child is going to end up being a professional something. It's, what kind of choices would you be making as a parent of an elementary school child? Would it be something, why year-round anything? Because their bodies are in a state of growing and so forth. And so, again, I go back to the European model. For the most part, it's very fitness-oriented because, you look at the fads that we do in North America, every few years something fad shows up, but it doesn't mean necessarily that's a good thing to do and so forth. So I just come from a different perspective.
And let's get into, let's say, a typical day for Dr. Claudia at our office. Like, kind of walk me through your typical day.
Well, it starts really early, so at 7 o'clock in the morning we've hit the ground running, and usually first thing in the morning will be a lot of adults that will come in for chiropractic care, and then the second component is about mid-morning. That's when all our babies and pregnant women and toddlers, a lot of homeschooling families will come in for their wellness chiropractic care. And so then, so a day is just taking care of a lot of individuals from all age groups and so forth, but I primarily see a lot of families. So it might be mom and the 3 children. Later on, maybe dad realizes, maybe I should be under this kind of wellness care. This is a category, by the way, wellness care, that was something I created about 30 years in our profession. So that category, that ladder had never been branded that way. But when I started teaching it, that it was a whole different kind of perspective, rather than just being a relief chiropractor. I really believe, and particularly even in the work of Gonstead, that if he had had time, I think he would have been a wonderful wellness chiropractor. He was doing so much with learning and teaching others. But I really think, long term, would a healthy, well-balanced adjustment periodically through the lifetime of an individual, what would be their quality of life if they had 30, 40, 50 years of Gonstead chiropractic adjustments? I just think that person would be much healthier.
Let's get into what you are, Dr. Anrig said. Make sure you ask about this. And that is working with children. In your words, describe to me why. Why do you work with children?
The why part is the fact that every child has a nervous system, and the nervous system controls everything for that child growing up. And so when we look at when do you kind of introduce, let's say, dentistry, well, when the child begins having teeth and so forth. But when we're born with our brain and our nervous system intact and it's functioning. And so even in utero, in the womb of the mom, the baby in the wrong position can actually be molded incorrectly. There can be just like a compression down, or the baby could have been even in transverse lies, and all these unusual positions here. And as a result of it, the baby may already have their spine slightly in a misalignment or a subluxation. And so that's why every newborn should be receiving a chiropractic evaluation. They may not need to be adjusted, but they certainly should be checked. And then periodically throughout the lifetime of the child, particularly the first few years where they're falling and they're tumbling and so forth. 50% of all children will fall from some height their first year of life. I mean, changing a bed, it could be from a table, it could be, so they're falling and landing traditionally on their head. So a lot of these children can have what we call in chiropractic an upper cervical subluxation. And this could affect their milestones. And milestones are critical this first year of life, learning to crawl, sitting, and walking, and so forth. And if you, by the way, interfere with the crawling mechanism, that can later on lead into dyslexia and other learning problems and so forth. So the milestone years of first year is critical, and that is why moms and dads, should really have on their team like a family wellness chiropractor checking their child to see if they need to be adjusted, because those first 5 years are critical for what they're going to be like at age 50, 60, or 70.
And so, for you, when you're, let's say, a newborn child, or I guess it's prenatal, that's what you're saying. So, what is your, I guess, thought process when a new patient walks in, and they're, let's say, first, second trimester, or whatever? What kind of steps do you go through in your head before you even start working?
Right. Well, we start with a really good consultation history, and often we're going to be asking her history of her falls and tumbles even growing up, or what maybe sports that she played, because that would tell us a little bit of impact of her spine. Typically in a Gonstead practice, we would be taking an x-ray film, but because of a pregnancy, we are not going to be x-raying. So we have to rely on our instrumentation, static motion palpation, visualizing, and so forth. And so we use all the tools except for x-ray. Now in chiropractic, postnatally, it might be then the doctor would take a post x-ray of her maybe a couple months after the birth of her child, so we can have a better understanding of the alignment issue, because often a chronic issue that they may have, we as a chiropractor should be looking at them on an x-ray, and so doing a post x-ray postnatally is important as well.
And then when you're working with a child, maybe you can even show us with your model, like what is, kind of go through, like this is your first adjustment.
Right.
Like what are you?
Yeah, and we always say there's nothing more important than that first adjustment. And so basically, a chiropractor, what they're going to do is they're going to do something called static palpation. So we're going to be running our finger along their spine just to see if we can pick up something called edema. It's almost like a water balloon. It's like mushy, and so we're looking for edema. And then we also look for then tenderness, because sometimes the baby will arch a little bit, that's uncomfortable. And then the next thing that we do is we do something called motion palpation. And the best way to describe it to a lay person would be like we're trying to push a swing, but the swing is stuck. And so that would be the restriction that we would call in chiropractic subluxation. And so once we've evaluated for that spine joint movement, then the doctor does just a really gentle adjustment. I mean, it's just very light, just a few ounces of pressure, and we adjust that spine. And there's no cracking or popping like maybe some people are accustomed to with an adult spine, but these adjustments are very gentle. Some of them are done right across the lap of a mom or a dad and so forth. And these babies are amazing. Babies who maybe had severe constipation, within minutes of an adjustment will just dump in their diaper. Babies who have had colic and reflux. I mean, I have G2 babies that through just a simple adjustment to the atlas, their reflux went away, and now they're starting to eat food, and we've taken the G tube has been taken out and so forth. So it's just amazing things. So there is kind of relief chiropractic care on a baby, but there's also could be wellness, and both all families should seek out a chiropractor for that reason.
And so, how many babies are you seeing a day?
Well, I could see anywhere from 20 to 30 babies a day would be very, very easy. It's 20 to 30 a day. And then the rest of the families will, it depends on, again, I see traditionally about 70 to 80 people on a practice day. And so that would be the majority of my day. Although we do have little geriatrics in our practice, because our practice has been there now 52 years because of my father. So I've seen some of the patients I'm adjusting are, when I was a little girl, they were coming in to see my dad at age 20, and now I'm taking care of them.
So there again, that's a multi-generational.
Multi-generational.
And when you're, like you just showed me, actually, can you show me again and thank you for explaining to a lay person, because I'm that person. Could you show me again how, because I noticed you just use your pinky.
Yeah, sometimes the doctor will use his or her pinky, If this is an older child, like maybe on your 3-year-old, then what it would be like maybe at the pressure like this. So it would be a pressure now, not sit up, but across, and laying on their tummy. So the pressure could be on with this movement here. So this is a movement, and then later on, the doctor might use his or her thumb and so forth. So depending on the height and weight of the baby and their development or their toddler child, and the hands and height of the doctor, we determine. It's like Goldilocks and the Three Bears. We have to pick our right fingers with their spine, and we match it up and so forth. Now, when we're working with an adult, that's a little bit different because it's about same. But when pediatrics, the doctor has from newborns all the way through teenagers, we adapt our hands to the height and size of the child we're working with.
I'm curious, when you're 20 to 30 babies a day, right? There's got to be a certain percentage in that, just sheer numbers, that I remember Dr. Sherman was saying yesterday, like, I think he was quoting Dr. G, like, find it, analyze it or something, leave it alone. The leave it alone part, he was stressing. So out of these 20-some babies a day, what percentage are you like, you know what, this baby's good. I don't need to do anything.
Yeah. Probably between 10 and 15% may not need to be adjusted that day. So the mom may be being adjusted, and she has a subluxation pattern, so mom might be adjusted. But in a wellness practice, we would then decide not to adjust that baby, and then when we're rechecking the mom, maybe a few weeks later, we would be checking the child as well, and so forth. But it really takes an expertise on palpation, and so sometimes what may be overlooked because in pediatrics, the younger the child, our instrumentation, the scope, is not as effective. So it really takes an art form of, and this is when I'm teaching young doctors and doctors throughout the world, is teaching them to really pare down their fingertips. The lighter they are in their palpation, the more they're going to pick up. And so sometimes some doctors will use adult palpation in pediatrics, and so it's like it's accurate to pick up the information. So I could probably sometimes take the same baby that somebody thinks they didn't pick, and then I would gently palpate, and I even show palpation to the parent. I'll do the range of motion, and then I put them on there, and I say, okay, do you feel that restriction? And even parents, if you lightly put them on the segment, you can show them restriction. It's quite amazing.
Finish the sentence. The biggest mistake I see new chiropractic doctors do is
in Gonstead or just in general?
Let's say in concern regarding pediatric care, Gonstead pediatric.
I think the biggest thing is that their nervousness, because they don't have a lot of experience. Maybe nervousness would be number one.
Sorry to cut you off, but could you say that, like, the biggest mistake I see...
All right.
Yeah.
Thank you. The biggest mistake that I see is sometimes nervousness with a young practitioner. That nervousness of I'm going to find something, the nervousness of giving a baby their first adjustment, because maybe we didn't have enough experience going out. The doctor has the experience. It just have to just go in there and do the adjustment. I think also it's just a confidence of really learning their palpation skills, because I've never seen a doctor yet, when they deliver the adjustment, they've done a fabulous job and so forth. And so, but that's usually sometimes a first young doctor out there, it's that nervousness of seeing somebody in that population group.
Do you have any technical things? I'm sure you do.
Yeah, I did have a question, but I was really diving in, or listening, sorry, I lost it.
Think about it. I got one more, and then you guys could...
Okay.
Or you got one right now? No, go for it if you have it. Yeah.
So with Gonstead being, it almost has carried the reputation or had the reputation of a very intense technique, like being hands-on, and that's just what you hear, right? And so can you kind of talk about the difference between, or how Gonstead not only how it's hands-on, but how it applies to an older person, but also how you tailor that for a child?
Okay. A good question that we get asked is, how does, in chiropractic, particularly Gonstead chiropractic, how do we tailor techniques from somebody who's older to somebody who's younger? That's the beauty of the Gonstead system, is that we have many tools to use. X-ray if somebody's a little bit older, a child's older, we certainly would be X-raying, to using our instrumentation, to static and motion palpation and visualizing, watching gait and different things like that. And so we're able to adapt in the Gonstead system all these applications of an evaluation. That's the beauty of this work, is that we spend 90% of the time evaluating the patient to see, number one, do they need to be adjusted? And then the accuracy of where they need to be adjusted and so forth. And I think and the art and sometimes the speed of an adjustment, that's the beauty of what we do in our Gonstead work, and it can be adapted to any age group, whether it's a pregnant mom to a newborn baby where the adjustment is ever so light, to somebody who might be, adapting a system. My biggest patient, he's 6'8" and 400 pounds, and I can deliver this, not a baby adjustment with him, but certainly just adapting to his size and his weight using a system that allows us to use different equipment to deliver the best adjustment.
What do you personally feel like is an area for growth for you? I know you've been doing this many years, but like many people who practice things for a lifetime, they're always seeking to improve, always seeking to learn, always seeking to get better at something, some aspect. And with the wide girth of experience that you have, where is some place that you're like, I want to get better at that?
I think we're always on a journey of improving, and I'm always on that journey of even improving my palpation skills. Taking that one moment to last a little bit longer on the tissue of the spine, just to palpate and so forth. So I just think, I've been enjoying the last couple of years, really even slowing down just a little bit more, just enjoy the palpation part of it, because I'm learning even here after so many years of practicing, I'm learning, there's even more to find in this journey and so forth. I love that. I love looking at x-rays. There's always something new that you can look at, and it's just beautiful to see how that spine, I love it, two reasons. I love it when I see a pediatric spine that I've been growing up with, and that spine has been with me for 10, 20 years, and I look at all the beauty of the curves, and that the spine grew up very, very straight, and I enjoy that journey that I was a part of that. And then at the other side of it, seeing, in the journey of when you see a spine that really has a lot of, toughness, wear and tear on it, is how do you, by looking at that x-ray film, how could you deliver a better adjustment? So my journey lately is just enjoying viewing x-ray even at a greater depth and love, and the same with palpation.
And just a couple more things, you good?
I remember my question.
Because your dad's in the room, right?
Yeah.
You're probably looking at him over my shoulder.
Yeah.
But that's kind of a cool aspect, that you and your dad are somebodies in this world of chiropractic care. And what is that like, working, I would say, in the same field as your father? And now you're seeing multi-generations as well. So like, as someone who's a daughter of a chiropractor, as a chiropractor, I don't know if you have children who want to be chiropractors, kind of explain that. I'd say as a daughter,
Right.
What is that like for you?
Oh, it was wonderful. Just showing up my first week of practice and knowing I wasn't as good of an adjuster as my dad. And my dad pulling me to the side, and every lunch hour, he'd help me become a better adjuster. And so, he just helped me build up that confidence. And also, too, when you're a younger doctor, a lot of times you don't have all the experience. Knowing I could walk down a hallway and the master was down there, and he could fix anything. If they had a spine and nervous system, and we could deliver a good adjustment, any physiological improvement could happen with a good adjustment. And so it was a powerful thing as a younger practitioner, is to be able to have with confidence somebody down that hallway that, he's just amazing. And this is a person who would say 3 words in a room, 3 words to his patient, never hardly talk, but his intention was so great. It taught me the power of just your being there in presence. And so for somebody who I make up on the other end, but he is, his ability to walk in and have the confidence in finding a subluxation, delivering adjustment, and helping people on their journey, that's always been amazing. And even now when I travel, Dad covers for my practice the babies and the toddlers, except that we just call him Dr. Adorable. And so all my babies and kids, they can hardly wait, when am I going to teach again? Because they know they've got my dad in the room and they love him to pieces.
So before we ask Dr. Adorable to take your seat, I'd like you now to turn your eyes right here to this camera and speak directly to this camera in the first person and just talk to the future chiropractors out there who are thinking about getting in the field and doing what you do?
Oh my, do we have an amazing opportunity for those of you who would love to be in just in natural healing arts, but like to be a doctor as well, and the opportunity to just take something from a different perspective. Whatever in the field that you would like to become a chiropractor, maybe that specialty of it, we have certainly room for you, and we have certainly room for you in this Gonstead technique. I mean, we adore and love our student doctors, our young doctors, and we honor those that have been in practice for 50 or 60 years. I'd encourage you to join us. If you are starting to think about chiropractic as a career, when you reach out to somebody and find out what right colleges to go to, make sure that you get into a Gonstead club and come to all these seminars, and we will train you so that when you get out into your practice, you will have such high success, because we'll show you the science and the art and the philosophy of an adjustment, which is all about the Gonstead technique. And we just encourage you. We need generations of you out there to make a difference for humanity. And whether it's pediatrics or prenatal, then you'd be using my textbook, to the fact that you just would like to serve an older population group. We're asking you just to come join us. We are a great profession, and it's a technique of Gonstead. We are a great family to join. So hopefully we'll see you in the future.
Yeah. Thank you so
You're welcome.
much. Thank you. That's easy, right?
Yeah. Oh, yeah. That's easy.
I know. I was like,
You caught me off on the sports thing, because I usually don't. I'm not the sporty talker, but that's okay.
no, that to me, I was like, oh, that's right. You know, you kind of favor one side.
Yeah. It's a, yeah.